Former military leader advocates for MDMA-assisted therapy for veterans, a former chief of the British military, Sir Nick Carter, is urging the government to streamline regulations surrounding MDMA, ecstasy, to facilitate more affordable research into its use as a treatment for post-traumatic stress disorder, PTSD, in veterans and emergency workers. Current restrictions inflate the cost of obtaining medically pure MDMA to roughly £10,000 per gram, compared to its £40 street value, hindering clinical trials. Breakthrough research supports the case the push for easier access stems from recent findings published in Nature Medicine, which demonstrated PTSD symptom elimination in 71% of patients undergoing MDMA-assisted therapy. Carter argues this suggests the potential for greater efficacy than existing treatments, particularly for the approximately 9% of military veterans affected by PTSD following deployments in conflict zones like Iraq and Afghanistan. The core issue is not decriminalization, but practical accessibility for medical trials. Carter proposes reducing the classification of MDMA specifically for research purposes, allowing more affordable acquisition and broader testing. This isn't limited to veterans. Police officers, NHS workers, and other first responders could also benefit from this approach. The science behind the treatment MDMA's potential lies in its unique neurological effects. When administered in controlled clinical settings, the drug increases brain plasticity, making patients more responsive to therapeutic exploration of deeply ingrained trauma. This involves 2 or 3 extended therapy sessions where patients confront issues they would typically avoid. The goal isn't recreation, but a carefully supervised process to facilitate emotional processing. Veteran shares experience Martin Wade, a 53-year-old former military lawyer deployed in Helmand Province, Afghanistan, underscores the urgency of this debate. Wade developed complex PTSD after years of grappling with legal and moral dilemmas during his service, including investigating civilian deaths in combat scenarios. 1 round, 3 dead civilians. I can feel my body now. Where do you start? Wade recalls. Despite years of conventional therapy, Wade continues to struggle with hypervigilance, flashbacks, and nightmares. He believes MDMA-assisted therapy offers a potential breakthrough, describing it as a method that could foster a sense of self-love when addressing traumatic experiences. Funding and next steps, the University of Cambridge is currently seeking £2 million to fund a larger trial involving approximately 40 participants, veterans, first responders, and war correspondents through a partnership with the charity supporting wounded veterans. Roughly £700,000 has already been raised. Carter highlights the stark contrast between the exorbitant cost of military weaponry, such as £80,000 missiles, and the lack of adequate funding for veteran mental health care. The debate over MDMA-assisted therapy is not about recreational drug use, but a serious reconsideration of how best to treat those bearing the invisible scars of service and trauma.